The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. We are really excited about today's webinar, Digital Medicare, Proactive Positive Response to a Changing World. All of us at ConnectSure sincerely thank you for being here. We know you may be experiencing your own challenges, both personally and professionally. We understand you may be researching proven solutions and looking for guidance to help you better navigate new digital waters. Today's Medicare world is one where online, mobile, and work from home reign, and where in-person is no longer an option. ConnectSure Digital Medicare is not new, but what is new is how people are responding to it and the speed with which it is growing in importance in the world of Medicare shopping, quoting, and enrollment for all audiences. We will share our data, experiences, telework technology, customer journeys, and even a brilliant Harvard Business School strategy. So please make sure you stay until the end, all to help you build relationships in a time when everyone's world has been turned upside down. We want your questions, and we'll take a few when we are done. So please type them into the chat box. We will follow up after the webinar with additional information for any questions we don't get to. This webinar is also being recorded and will be available on the ConnectSure YouTube site. I'm Kara Tarantino, Director of Marketing with ConnectSure, and I'm thrilled to be here today with our presenters Grant Hoffman, Executive Vice President of ConnectSure, and Susan Plumer, our Vice President of Sales. Grant will talk about how the profile of the senior in 2020 has already so quickly changed from the senior in 2019. He will also present highlights from our 8th annual Voice of the Medicare Consumer Survey. Susan will delve into digital engagement strategies and talk about our solutions in the context of business continuity to help you understand how you can increase enrollments and stay fully compliant, all while working from home. She will provide examples of our telework technology tips and what we're doing to help ensure our own customer success. She will also share our solutions that support network distribution, member retention, and brand protection, and provide insights from our Voice of the Customer case studies. We have a lot to cover, so now I'll turn the presentation over to Grant.
Thanks, Kara. Appreciate that. Hello, everybody. This is Grant. I hope that you and those you love and care about are being spared the worst impacts of COVID-19. And I'm really wishing safety and success for all of you. In ConnectSure, we're a technology provider, and many of you are direct or indirect customers. But like you, we're grappling with how best to stay close to you and to build solutions that bridge that forced distance between you and your beneficiaries and your members and your prospects. So if you aren't familiar with ConnectSure, however, just a quick note that we've been in business since 1999. We were originally called Destination RX, and we were the pioneer in consumer drug comparison and Medicare shopping technology. DRX was acquired by a company called ConnectSure in 2013, but the company eventually shed all of those non-Medicare and drug compare solutions, and we were acquired by Harris Computer Systems in 2019, and we effectively operate as a standalone business unit. So we rebranded late last year to put DRX back in our name, since that's really still fundamentally who we are. We're proud that with our customers, we cover the vast majority of the market, and that coverage is increasing each year. So we're also known for our gold standard drug pricing, where our data is used as an accurate and reputable source for drug pricing in the industry, and with a lot of healthcare and financial publications also. But our mission is just to simplify healthcare choices for seniors and to help the health plan and the broker customers that we serve to grow and keep their membership. So we're a digital Medicare company at our heart, and our mission is supporting your business continuity efforts and telework and getting the best fit Medicare plans to beneficiaries based on the most accurate annual out-of-pocket estimates. That's really what we're up to. And I think we'll start a little bit with some profiling of seniors. This is a lot about what we're doing today is to share some of the results of the surveying work that we've done. And if you recall 2019, as recently as a few months ago, the traditional vision of retiring was changing, and the trend was toward a more active retirement, where folks were blending work and personal pursuits, and seniors were active and living longer. They were geographically mobile and digitally savvy. 72% of seniors were continuing to work, and that was not just for financial reasons, but for healthy aging reasons. And almost half saw themselves as easing into retirement by working less, but not stopping entirely. If you fast forward just a few months, we've got a new picture of the pressures on seniors that we're serving together. And it's a picture that hasn't completely formed yet, but it has some obvious implications for a high-risk group in a world that's struggling to respond to a pandemic. In the early months of 2020, as we sit here today, there are some risks to seniors' physical health with disease and their mental and emotional health, perhaps even more so, with isolation and concern. And I see that some with my own aging parents, as their world of in-person connections has been reduced. And now their digital presence online is critical for social connection and just getting daily life done. And financial security is also an issue for many of these. A senior's ability to connect digitally, I think I'm probably preaching to the choir when I say this, but their need to understand Medicare and the options available to them, it's never been more important. And as I've told my team internally, our mission has never been more crucial for what we're doing as a company in trying to help serve our customers as you in turn try to serve your members. Those seniors have questions, they're reaching out via phone and online for answers, and we as an industry need to supply them with the relationships and the information that they can trust so we can all get through this together. And what we're going to do is we're going to take a look at the results of our surveys to figure out how we can best support the senior in 2020, even though we're working with a data set that dates back to the very end of last year. So 2019 was the 8th year in a row that we've surveyed customers in our Voice of the Healthcare and Medicare Consumer Survey. And this past year, our survey was more focused on 65 and over, with a subset of responses for those that are in pre-Medicare, say 62 to 64 age group. We've surveyed over 12,000 consumers to date in the 8 years that we've been doing this. And this year we processed almost 2,800 responses to the surveys. So we sent the survey immediately following the annual election period, following AEP in mid-December, if you're curious. And our goal in doing the survey was to accomplish three things. First, we wanted to get insights around how retirees are thinking about Medicare shopping and enrollment specifically, and then asking about that also in a digital context. Second, we look very hard at year-over-year trends with the intent of helping our health plan and our FMO customers protect their members and their brands. And then third, we're using this input to prioritize the new software features that we can then roll into the solutions that we roll out to the market. So there's certainly some selfish reasons behind that, but a lot of it is trying to inform the core understanding of what we need to do with our solution and those involved. So I think we'll give you a snapshot of the Medicare profile, specifically the Medicare profile of the seniors that we surveyed. 3/4 of those are retired, a quarter are still working, 17% purchased a Medicare plan for the first time in 2019. Almost half of the respondents we had purchased a new plan, but were not new to Medicare. So we probably oversampled a bit for switchers in our survey. 38% did not purchase a new plan during AEP 2020. Interestingly enough, the product breakdown, 65% original Medicare, 39% with Part D, 37% with Medicare Advantage, and then 25% Med Sup. So pretty good distribution across a different type of products. One of the critical questions that we asked seniors is assessing their impression of access and quality of the information that they have, just broadly speaking. And consumers, not surprisingly, are all over the board in how they perceive the information that they have available to them when they're trying to make decisions and learning more about Medicare options. A full 1/5 of the respondents in our survey said that online is sufficient. And another 18% say, okay, our first choice is to go to our current plan. So these are self-described individuals as happy with their plan, but almost 20% go first there. For 13%, their first inclination is to stop is at the broker or the health plan because they depend on them for clarifying plan options. And then there's a 10% that still remain confused by the options after searching online. And interestingly, paper form methods of information are the least attractive as a first source. So as the digital connection becomes more important, simplification of the messaging through plain language and videos and iconography and symbols, it's becoming more important to help seniors understand the information that's available to them. So regardless of how they do their shopping and their plan research, we asked seniors to rank what's most important when shopping. And the most material year-over-year change was the rising importance of prescription drug coverage. So if you unpack that just a little bit further, a third of respondents told us that getting their specific prescriptions covered was second on their list in the ranking of priorities. And so they're ranking low monthly premiums and keeping their current doctors just behind. And this ranking isn't surprising. It also corresponds to the number of active prescriptions and the type of prescriptions that are taken daily until you get to sort of the tails of the stats. According to Consumer Reports in a November 2019 article that was entitled "The Shocking Rise of Prescription Drug Prices," 30% of Americans who take a prescription say that their out-of-pocket cost for a drug that they regularly take has increased in the past year. And of those, 12% said that their drug costs were up by $100 or more. Those who saw increases in their out-of-pocket costs were 2 times as likely not to fill a prescription or to have some impact like foregoing medical treatment or taking on additional jobs and opportunities in order to try to kind of even that out. So as the importance of prescription drug coverage rises, and we get tapped all the time for media requests about some of the data analytics we have about drugs and drug pricing, we wanted to find out from seniors if they're actually doing comparison shopping or if they're asking their doctors about alternative prescribing choices. So in our results, keep in mind this is a survey of what people are inclined to do or likely to do. Half of the surveyed have compared drug prices, and the majority of those are doing so via a health plan website, and then the second and the third sources of comparison that are most common that they purport that they do or would do is via a pharmacist or an online pharmacy website. So we also asked whether they would ask about alternatives to their drugs that they're taking. 83% said that they're interested in alternatives, with a primary driver for that interest being price. Parenthetically, whether they actually follow through on that expressed interest in alternatives or shopping is a little less certain. Right, so we have the benefit of being able to compare this data that we see about attitudes to what we actually see in the enrollment activity patterns. And I would say that is increasing year over year, but I would say the number that take advantage of it maybe isn't as high as they say that they will. I mean, there continues to be opportunities, we think, for seniors to be more engaged with the cost of the medications and to understand that they do have some options that are available to them. And drug comparison tools, there are some out in the market, certainly are drug comparison solutions. They're really critical to helping consumers compare prices and better understand the therapeutic alternatives they have available to them as they're connected to an understanding ultimately of total out-of-pocket cost. So we asked consumers specifically how they shop for a Medicare plan, and we've seen a steady increase in expressed interest in shopping online with little or no assistance, and that's up from 39% in our 2017 version of the survey to 43% in 2019. And this mirrors certainly a trend that we see year over year in a slight rise in unassisted enrollments and in blended enrollments, which are sort of a mix of agent interaction and digital interaction, where you might start in one channel and finish in another. There can be a gap sometimes in what you say and what you actually do, but in this case, the trends are pretty consistent. And shopping online without assistance is continuing to go up. And it'll be interesting to see what those trends look like this coming year. We also wanted to find out why consumers stay with their current plan. And trust is number one, right? Trust of the company, being happy with their plan, that's far and away the reason that consumers stay with their current Medicare plan that they have. A distant and significantly distant second at 13% are consumers who believe they've found the best plan option after shopping around. And this sort of underscores the research by other firms that switchers aren't the majority of the total Medicare population, when they trust a brand, they tend to stay with that plan, which can be good news. Typically, though, I think a lot of our attention focuses around the switchers. So for the switchers in our survey, 29% said that they found a less expensive plan with another company. So in that case, that's cost as a primary driver. And in that case, evaluating it in the context of a premium. 26% were not happy with their current plan, company, or coverage. So those have some sort of disturbing event, like a physician change in the network, denial of coverage for some reason, and then another third told us that getting their specific prescriptions covered was second on their list. So that's I think that gives you sort of a sense of kind of how folks are breaking through and thinking about this. But we thought that would be sort of helpful insight. It is important to note that 20% were still guided by a broker to a better fit plan. So broker support and influence is critical. Another 16% wanted more supplemental benefits. So switchers, they're relying on brokers and agents to help them find their best fit plans. But that breakdown probably is not surprising, and I think that's consistent with research that we've heard from others. Looking a little bit further about shopping and switching, we'd also like to share a little bit of insight from Depth Research's 2020 shopping and switching study. We work really closely with Depth Research and with George Dipple and his team, and he has an outstanding presentation this year, as always, regarding why people are switching. There are a couple of points which corroborate some of the results that we've just been walking through. Online enrollment is up. Historically, Depth has seen online enrollment figured in the teens, but in 2019, that was up to 23%. Again, we're all trying to kind of get a sense of what we think that might look like this year in online shopping trends, especially considering the impact of coronavirus and social distancing. Anecdotally, I would say that our SEP period activity year-over-year volume is up for same store clients that we have. So we are seeing, a rise which portends that a bit, even in terms of some of our activity. And of the online enrollment, I guess I should say half of the switchers that met with an agent. And so it appears that if they switch, they do want human help with enrollment, even if they shop online. So their self-service enrollment is improving, but broker assistance is still clearly key and a key influencer in making those decisions happen. Access to Medicare Advantage overall improved primarily due to the introduction of the $0 premium PPO. Adapt has reported that people are typically loyal to the plan type, with MA folks staying with MA, MedSup sticking with MedSup. But as access to Medicare Advantage is improving, for the first time, they're starting to see consumers crossing the plan type line a little bit more frequently. And I think it's of note, it's probably also important that preventive dental and comprehensive dental benefits are a big deal with seniors. And then the over-the-counter allowance is also having an impact. And the allowance of $40 per quarter for over-the-counter is a free cash benefit that seniors are attracted to. So again, it feels fairly consistent with a lot of the things that we see on our side, but we thought we would share a little bit about what we've seen from Depth just to connect it. Maybe switching back to the Connecture DRX Consumer Survey, we dove a little bit more into that question of trust a little bit more closely. And as we asked the question in particular, which channel are channels that you trust for getting information, for making decisions. In 2019, trust in private carriers rose by 7% from 2018, and trust in medicare.gov dropped as a source. For those who were familiar with it, dropped 22%. And that's maybe not surprising for those of us in the industry, knowing that there were some challenges with medicare.gov in launching their site this past year. But trust in independent brokers and agents also had a small uptick. Now keep in mind this question as asked generically about agents. So when someone has their agent in mind, specifically my agent, that number spikes significantly. But as a side note regarding this idea of trust, per Depth Research, they also noted that some of the changes in the new medicare.gov plan finder led people to the sense that there wasn't enough information available necessarily to make a good decision. And so people year over year relied a little less on Plan Finder, and independent sales agents were the primary beneficiaries of that. And this past year, in part due to the Medicare.gov challenges, our personal goal with customers was to try to help them communicate to agents that they had a better option already available to them. We remind agents that the beneficiaries can enter and save medication lists, that there are tools to see how adding or deleting prescriptions can affect them financially, and to do that without having to share usernames and passwords. And so we spent some time just at a personal level co-branding marketing materials for our customers to help remind them and their constituents about the tools that they had available to them. Then getting close to wrap up, I would say that our ultimate goal is to pair beneficiaries with their best fit Medicare plans, right? So the best fit plan, when we ask these questions, it's one, in our definition, it's one that considers drug cost and total annual out-of-pocket estimates based on an individual's personal profile. We asked Medicare consumers if they believed that they are paired with their best fit plan to try to ferret out a sense of kind of what they would define it as. So, what really makes a best fit plan, according to consumers, 40% said that if both the premium and the other costs were lower, then that was their best fit plan. So there's sort of your total out-of-pocket cost voters. Then 35% said their best fit plan had the lowest total annual cost. And another 30% still believe it's the $0 premium that makes a plan the best fit, followed by 26% who believe that the plan was the lowest drug cost, with is the best fit plan. And a quarter felt strongly that the plan with the best supplemental benefits was the best fit plan. I mean, the bottom line is ultimately seniors want money back in their pockets, and they want to make sure they have the coverage. The only way to ensure that is to have a best fit plan that includes not only the accurate total out of cost pocket estimates, but along with the drug cost and the coverage. So if the drug costs aren't included, consumers might well be paying more even if the plan is a $0 premium. You guys can all take a little bit of a breath. And I know we shared a lot of our survey information out there, and we're trying to combine that again with our enrollment information. But with that in mind, I'll remind Susan to take herself off mute, and I'll turn the presentation over to Susan Plumer, who will continue with Digital Medicare. So Susan, over to you.
Thank you, Grant, and good afternoon, everyone. It's my pleasure to be with you today, and I too hope everyone is remaining safe and healthy during this uncharted time. As has been mentioned, Connector DRX has been in the business of digital Medicare since we started the company, but now we find it has taken on an even greater meaning and an even greater importance. Unlike many companies today, Connector DRX does not have to reinvent itself during this time. The foundation of our company since 1999 has been built on digital connection and serving our customers electronically from implementation to execution and beyond. And as Grant shared, the profile of the 2020 senior has already changed from how it was several months ago. Their concerns, however, remain the same, such as rising drug costs and finding affordable coverage. Change also brings challenges for agents. For many agents, shifting from a paper-driven and an in-person meeting world to 100% online is not easy. And many agents might be wondering if they can depend on medicare.gov this AEP, especially after the colossal failure they experienced last year. So being in a crisis necessitates behavior change on many levels, and the predominant change we will focus on today is the drive towards successful digital engagement. We also want to focus on how we can take ownership of our current situation together. By looking at insights and learning from those who have experienced success, we can help you reevaluate your current processes to bridge the digital divide, regardless of the platform that you use today. In the next couple of slides, I'd like to share the solutions that make up our digital Medicare framework. These solutions include Plan Compare One for digital shopping, quoting, and enrollment, our BrokerLink distribution network, and our Medicare retention suite. Plan Compare One, which many on this call may have already heard of, launched this spring, and we will be live for our customers this AEP. Our ultimate goal with Plan Compare One, as we frequently discuss, is to pair every beneficiary with their best fit Medicare plan every time. It's one platform, one seamless omni-channel approach for professionals, call centers, and consumers alike. Plan Compare One completely supports business continuity and telework, enabling all audiences to easily connect via the phone, laptop, and/or tablet. It's highly configurable to include your own brand in a way that best supports your business model. Everything we do can be private labeled for you. Plan Compare One also supports API and hosted options. It allows for more informed decision making due to its simplistic flows and intuitive design. So whether you're a health plan, a call center, financial institution, aggregator, multi-carrier agency, or frankly, any other organization, this platform will support all your business needs. The most important thing to health plans and brokers, especially now, is distribution. And we always consider the impact network distribution has on being able to connect with audiences to grow a business. As a result, we have the largest distribution network of any Medicare vendor today. Health plans want to connect to as many agents as possible, while at the same time, agents want as many carrier options as possible to increase their distribution to consumers. So this slide shows you some of the highlights of our BrokerLink distribution network. Multi-carriers choose the carriers and products they want to sell, and with everything in one place through a single integration, this network drives continuous electronic enrollment. And to give you an idea of just how valuable this is, 26% of our enrollments in 2019 came from our BrokerLink network. So I'm going to brag a little here because we really do have an exceptional team that has worked incredibly hard over many years to get us where we are today. And I personally couldn't do my job without their expertise and support. I also want to show you that our distribution network really does make a difference, and these numbers tell our market leadership story. We've had now actually over 800,000 enrollments in the past 12 months, and 425,000 of those were from AEP 2020 alone. 75 health plan customers use our platform. Over 104 now carriers provide either data and enrollment, and there are over 4,600 health plans that actually sit on this platform. So those are some pretty staggering statistics, and we're very proud of them. The multi-carrier side of our business has been exploding with more than 50 multi-carriers using our technology today. We contribute this growth due to the medicare.gov changes, as well as due to the need to digitally connect in light of COVID-19. We've been continually adding new carriers to our platform, making that an integral part of our mission to help drive new business for our customers. And as Grant indicated earlier, our health plan customers corner the Medicare market in MA, MAPD, PDP, and MedSup. Another area gaining even more importance is the ability to retain members and protect your brand. Our focus on retention and protection reminds me of a quote I recently saw from Mark Cuban. He said, "How companies treat people during the pandemic could define their brand for decades." He further indicated that what we are experiencing today is not only a safety issue, but a business issue. Retention is also one of our digital engagement strategies designed to help protect brands by maintaining, building, and growing customer loyalty. We accomplish this through what we call our Medicare Retention Suite solution. It focuses on these 4 key areas. First is retiree transition. So if you're a retiree exchange, this helps keep members with your brand as they transition from group or employer insurance to Medicare. Members can enroll in a Medicare plan in a very personalized way. Agent members, as you are all trying to capture the 10,000 consumers a day that are turning 65, this is the group you want to connect with early and to stay ahead of the competition. Switching. Switch prevention is key, as you want to make sure you get ahead of plan switching before it is most likely to happen. And plan changes, sunsetting of plans, and formulary changes, they all happen. So you want a means to keep members informed and prevent unpleasant surprises for them. For example, if you know that a plan change or termination will affect your members, the Medicare Retention Suite can help you protect your book of business. A PIN-based site helps to direct members to shop for other plans that are available in their zip code. We love the Medicare Retention Suite because it is a reliable tool that helps our customers meet their beneficiaries where they are on their own journeys. They have meaningful online conversations and build relationships and trust on new levels. Again, it is this trust that builds loyalty, drives revenue, and protects brands. Authenticity, honesty, and a personal voice makes for more meaningful digital connections. It's also what makes social media successful. Relevancy and message simplicity that get people to take action matters a lot. And getting up to digital speed quickly is where we are today. So we actually found this highly relevant message on LinkedIn posted by one of our customers, Gordon Marketing. Here, Sylvia specifically calls out Pennsylvania just prohibited face-to-face broker sales. So if you don't know how to work electronically, you need to learn fast. We know switching from paper to online may not be easy for some, and in the past, agents may have dragged their feet. We also realize taking a business grounded on years of face-to-face meetings and having that foundation crumble in a matter of weeks is not easy. We are sensitive to the fact that many people identify not just with their work, but also in the way they do their work. So building a digital foundation for a company is built in the same way a brick and mortar foundation is built. One brick at a time, one digital connection at a time. And I think you would agree it takes a minimum of two to connect. And in all likelihood, the person you are trying to build a digital relationship with may be experiencing the same digital jitters you are. Haven't we all said at some point after a long and drawn out meeting, that meeting could have been easily done on an email, referring to a time in our day that we will never get back. Ironically, now we get our wish when the web and email are our only options. When switching to connecting digitally, let your customers help. Let them be part of the journey and take your customer experience to new heights. Being relevant is key. Here are some examples of how we are engaging on new levels, staying relevant and including our customers in our own journey. Everybody in Medicare wants to expedite enrollments. So fortunately for ConnectYourDRX customers, you already have the shopping and enrollment tool literally in your hand to get the job done. We also recognize not everyone has a tool uses it optimally or even at all. That's why connecting our customers to their agents is one of our digital engagement strategies. We support our customers with content and guidance so the tools agents have in hand become an integral part of their lives. We've created, and you may have heard of it, a program called Telework Technology Tips. These are easy to understand, helpful tips with things like quick quote, electronic scope of appointment, personalized shopping links, self-service enrollments, and completing enrollments with the ease of email signatures. We help you work the way beneficiaries want to work and work across all devices. As we understand, beneficiaries may be comfortable with one device and not another. Some are more comfortable switching back and forth between devices. The other thing we do that's really important is we co-brand all these materials and customize contact information for our customers for free. Yes, I did say for free. We turn around materials as quick as possible so customers can get them into the hands of their agents to take action right away. We look at it as on-the-job training to get agents up to digital speed quickly. We understand the importance of developing online confidence and know it can be learned and gained through repetitive guidance. Our step-by-step tips are more than just a how-to. They are also aimed at building the confidence in those who may have had a hard time transitioning from old-fashioned ways to the world of technology. Confidence builds as agents take steps to change the way they do business and become successful in the process. We like to show the online engagement between brokers and beneficiaries. Here is an example of an electronic scope of an appointment process. So you can see what your consumers see, you can anticipate their questions and better guide them toward a positive shopping experience and a quick and successful enrollment. In the next couple of slides, I'd like to share with you some insights from our Voice of the Customer case studies. One of our clients, Integrity Marketing, you may have heard of them, also builds the confidence of their agents through video training that includes role playing. They have been able to fast track online enrollments with the Connector DRX platform, private labeled as Medicare Center, through their highly efficient agent onboarding process. They have standardized agent logins and effectively use shopping links, also called personalized URLs, to increase electronic enrollments. And by allowing agents to do everything in one place, they have made accessing Medicare Center a seamless process. They have used our co-branded marketing to its fullest potential, and agents know they are completely supported in the process. Another Integrity Marketing FMO, Cornerstone Marketing, has also used the Medicare Center platform with great success in increasing enrollments. A reliable recruiting tool for agents, they experienced a significant increase in agent adoption as a result of the medicare.gov changes last year. Agents adopted the platform quickly due to the efforts of Integrity and also gained online confidence when they realized how much time they were actually saving with quoting and enrollment. The results from one year to the next were astounding. During AEP 2019, they had 39 enrollments, and that rose to over 3,000 enrollments during AEP 2020. They went from 14 agents using the platform to over 200, and from 4 carriers to almost 20 carriers. So congratulations to Cornerstone. Connector DRX also provided some content for their website to show agents that Cornerstone is committed to providing the tools, training, and marketing necessary to support telework and business continuity planning. The Brokerage is another customer who has had their share of challenges over the years because agents held fast to old ways of doing things. Agent adoption did not happen overnight, needless to say, and they too experienced difficulties with Medicare.gov this last AEP and ran into additional complications when Aetna sunsetted some of their plans. So they looked to us as one alternative to Medicare.gov and connected agents where and when they needed assistance. Together, we increased training and registrations during their week-long agent meetings as part of their Fall Texas Roadshow. Co-branded materials also helped get agents up to speed quickly, and similar to Integrity, their Simply Enroll private label platform became a great agent recruiting tool. So after some bumps along the way, the Brokerage tracked 141 agents on the platform this past AEP and well over 3,000 enrollments. And they are perfectly poised today to reach even higher levels of online enrollments this year. Please make note, all of these customer case studies can be downloaded and found on our connector.com website. And there's actually lots more good ones as well. So I have 2 final slides I'd like to close with. Today, we are doing our best to take ownership of our situation rather than allowing the situation to take ownership of our customers. According to a March 2020 Harvard Business School article, The coronavirus is already rewriting the future of business. Digital Medicare is without a doubt helping us to weather the crisis and preserve bonds with our customers. And working remotely and developing right customer relationships is all about building trust. It's also why we always make trust an integral part of our Voice of the Consumer surveys. I'd like to share with you today 5 key strategies that help companies weather a crisis and preserve bonds with customers. It's called the HEART framework of sustained crisis communication. It requires we be customer-centric and aware of what people need right now. It's about giving your customers your heart during difficult times. We like these strategies so much, we are adopting them in our own company, and we welcome you to adopt them in yours. So let me take you through these. First, humanize your company. Let your customers and beneficiaries understand the circumstances and tell them you care about them. Do your best to spell out the steps you are doing to help. Educate about change. We are all motivated by our customers' best interests and need to show we are being proactive about changes. Assure stability. Let customers know you will continue to provide what they know and love. We want our customers to know we have been around for 20 years and we will continue to be there for them. Revolutionize offerings. As more than one wise person before us has said, recognize that chaos presents opportunities for innovation. Do something different today than you did yesterday. And lastly, tackle the future. Go above and beyond and point to silver linings. Know that you can have all the tools and support you need to digitally connect. Know that together, we are well positioned to manage the chaos and be stronger when things get back to an even newer normal.
Great. Thank you, Susan and Grant. As you've been speaking, a number of questions have come in, and we'll take some of them. Just as a reminder to everybody, we added a handout so that you can get some more information on our Plan Compare One platform and solution. So please take a look at that and download it. Let's see, Susan, I have one for you. How long does it take to implement Plan Compare One and get your system up and running?
Sure. So our typical implementation is less than 4 weeks, especially for our health plan customers. But for a multi-carrier, we do rely on carrier approvals and a lead plan sponsor for CMS approval. So it's best to plan your implementation well before AEP.
Great, thank you. Grant, I'm going to send this one your way. I'm a health plan and would like to be on your distribution network. So how do I get on board quickly?
If you're already a customer, we'll already have the data and the formulary information necessary. And what's really key there are just the permissions to extend that to distribute things to appropriate brokers of your choosing that you're comfortable with. The account manager is probably your best route to doing that. I think for those who aren't familiar with that process, it's probably worth mentioning that our approach to data is something we're very sensitive about as it relates to the health plans. You know, the carriers own that information, and we want to make sure, since they're our customers too, that we're using only accurate and up-to-date data. So we're sourcing. This is a bit parenthetical, but we're sourcing that data approved directly from the carriers and then providing that based on carrier permission. So it's as much of a permissioning process as anything else to make sure that we keep those distribution networks intact and that people are making decisions with the latest and the most accurate and up-to-date data. If someone is new, I guess I would finally say that if someone is a new, like a health plan that's not currently a customer of ours, the process largely builds off of the data submission files that are already submitted to CMS, and that can be as little as a 4 to 6 week process. But kind of the care and attention we take is primarily around first making sure that data is accurate and that it's going to authorized sources. But yeah, there's certainly a lot of demand for carrier information. and for people being on the selling and distribution network from our multi-carrier FMO customers. And we're trying to make that match and that connection as thoughtfully and carefully and as quickly as we can.
Let's see. Next question regarding the retention platform. Susan, why don't you take this? Can you buy your Medicare retention platform if you don't have the Plan Compare Shopping and Enrollment one?
That's an affirmative. Yes, you can absolutely purchase retention separately. But the good news for customers that have or purchase with Plan Compare One is that it is integrated with your broker site. So those agents can see on their own site when a beneficiary enrolls using the retention platform.
Okay. We touched on this a little bit, but I guess it has come up again. Grant, how can agencies be proactive in retaining beneficiaries if a carrier terminates or makes plan changes to a Medicare plan?
I probably would say that the peer agencies are probably better, or probably the best ones to answer that. But I do think that staying close to your carriers and communication is probably really key. This is if something like that happens, that's really stressful for the carriers as well, for the health plans. But a multi-carrier product list and inventory is probably a smart hedge if you're not already doing that. I mean, selfishly, obviously, our retention module can take expiring plans and you recommend alternative best fit options, and you can manage that, appropriately. But I would say that regardless of what platforms you're using or how you're doing that, one technical suggestion would be to make sure that you have integration with your CRM systems or ability to quickly pull that book of business so you can whatever folks are tied to that plan, that you can rapidly either upload or export them so that you can then have a best fit plan for them ready to go as a recommendation and run it through the process. So, there's a little bit of data work behind that. So if you get wind that something like that's happening, make sure you have that group queued up so that you can touch them en masse with actual recommendations as opposed to trying to have to do that piecemeal. So that'd be one tactical suggestion.
Okay, then Susan, I'm going to put you on the spot with this one because you did you did touch upon it with the telework technology tips, but the question has come up about, do you have the text? I can't really understand one of these words for SOA and the text to signature for app.
We currently don't have a text option. We do have an email signature option. A couple things I would say behind that is we do a lot of research with consumers and beneficiaries using our technology, and that was actually something that was not on top of mind for our beneficiaries. So as we built our product roadmap and, with Plan Compare One coming out this year, we do have Blue Button integration also this year. We have a lot more enhancements for this AEP, but it will definitely be on our roadmap as the consumers are getting more familiar with technology.
Yeah, and I think you brought up a good point earlier about the email signature capability being so simple and easy to use and responsive across all devices, which is really key, whether it be phone, tablet, or laptop.
Correct. Yep.
So then, Grant, I'm going to ask you one last question and let us wrap up before the top of the hour so we can give everybody some of their time back. This is more of a general one. How are you seeing the industry, the insurance industry as a whole, being impacted by COVID-19 from your perspective?
Yeah, you mean aside from the fact that we're all doing conference calls and webinars from our houses? I think the health plans and brokers are probably maybe the true experts on this, but certainly, we talk to our customers all the time, and at least what I hear from them is that the call centers are slammed with inbound beneficiary engagement. Folks are deploying tools and they're asking for help to try to reduce the metaphorical distance with the customers, for lack of a better term. I would say maybe for those that are less familiar with the back end workings of this stuff, don't underestimate the impact of changes maybe that are being made around, say, for example, like when a health plan has to waive the copay or is waiving for copays and cost sharing for COVID-19 treatment and diagnosis. They might be making a bunch of changes in back end systems, so that's more material than those that are just on the front end of this might realize. I think that maybe the takeaway that I would have is, they could do this as sort of a sum up, but everyone's impacted by the other branches of the ecosystem. So when providers are hurting or overwhelmed, that impacts the payers. When the payers are distracted and have a lot going on, that impacts the brokers and vice versa, right? So we're all, everybody is sort of exposed to everything else and trying to respond to this quickly. And so there's not a win or lose option that's out there. That if one branch of the ecosystem isn't successful, then none of us are going to hit the mission of supporting our seniors the way that we should. And that's kind of the point of this whole thing. Is it's because it's my parents, it's probably somebody else's grandparents or others that need to get the coverage. We're now not at a point where we can necessarily do that face to face the way that we could. Hopefully that will abate some. But just maybe having some patience with each other would be helpful. And I feel like I'm seeing that. There is something that's back to that heart framework. There is something that's very humanizing about taking conference calls, and kids might be yelling in the background and things like that. I mean, it just kind of reminds us that we're all trying to kind of pull this together. So I would say everybody feels a little stressed. The activity level is up, but maybe I would just sort of say people seem to be having an awful lot of understanding, and I appreciate that because the human element is sort of what makes this whole thing work. That's probably a longer answer than you wanted, but that's my take.
Great. Thank you, Grant. Thank you, Susan. And thank you all for joining us today. Please do not hesitate to reach out with questions. Grant and Susan's emails are right here. And we also welcome you to visit connecture.com and look forward to connecting with you again online soon. Thank you, everyone. Bye.
Bye.